Today we're going to talk about the Medicare Gap or donut hole. Most Medicare drug plans have a coverage gap, otherwise known as the donut hole. Here's how it works. At the beginning of each year, January 1, you pay 100% of the cost of your drugs until you meet your deductible. Once the deductible is met, you are in the initial coverage period. During this time, you pay a small amount for your medications, and your plan pays the larger amount. Usually the copays during the initial coverage period are relatively small, but Medicare keeps track of the total cost of the drugs, which includes what you pay and what the plan pays. Once the total cost of the drugs reaches a certain dollar amount, you enter the coverage gap. When you're in the gap, you pay a much larger percentage of the cost of the meds, and the plan pays the smaller amount. So your copays go up substantially. Many people cannot afford their medications when in the donut hole. So how do you get out of the donut hole? Your true out-of-pocket costs all count towards getting out of the donut hole. This includes all your medication copays starting January 1 and some discounts on brand name drugs while in the donut hole. It does not include what the plan pays or your drug plan premium. Once your true out-of-pocket costs reach a certain dollar amount, then you're in a catastrophic coverage state and your copays go down to very small amounts, generally $0 to $10. If you go into the donut hole and need help paying for prescription costs, you may be able to get help. Watch our video on what is a qualified Medicare beneficiary for information on reducing medication cost.